Good morning, everybody. Dr. Anita here from Mylon Family Chiropractic Center, and you're riding in the car with the Chiro. So today, our topic is going to be, are chiropractors just neck pain, back pain, and headache specialists, and that's all that they do? Well, the answer to that is absolutely not. The good news is, if you suffer with neck pain, back pain, or headaches, we have the best track record in solving those issues without drugs and or surgery. So let's talk for a moment about those drugs and surgery. Drugs cover up symptoms. While there are times where it's very appropriate in crisis, the reality is that drugs never, I repeat, never solve the why you have neck pain, back pain, or headaches, right? Surgical intervention may temporarily solve the initial issue, but it does nothing to address the things that created it in the first place, which leads to more issues down the road. There's a diagnosis out there called failed back surgery syndrome for a reason, because when you do surgery, even if it's absolutely needed, because there are times where it is, the spine above and below that surgical site will fail. So while we chiropractors are fantastic, good morning, Nancy, are fantastic at helping neck pain, back pain, and headaches, we also do a whole lot more. Why do we do a whole lot more? Good morning, Nicole. A whole lot more because the brain and the nervous system is the master control center of your entire body. Every tissue, gland, and cell comes from the brain, down the spine, out the spinal nerves, to all those tissue, gland, and cells, and back up to the brain so that your body is working at 100% of its potential. The deal is, if your spine gets out of alignment, your nervous system's not going to work right. Your life system's not going to work right. Your body is not going to work right. And your body will break down. And it may manifest itself as neck pain, headaches, or low back pain, but it may also manifest as asthma, allergies, colic, digestive issues, irritable bowel, all kinds of things, skin disorders, eczema, things like that, visual difficulties, dizziness. Gosh, I could talk for a million hours. Numbness and tingling down the arm and hands, numbness and tingling down your legs. I mean, my goodness, there's so many things that I could talk about. And of course, classic sciatica, right? So chiropractors aren't just neck, back, and headache people, although we are the best at taking care of that. We are body people. We take care of the nervous system so that your body can be at its best. So if you're not under regular chiropractic care, it's impossible for your body to be on its best. It is impossible, because if nobody's managing that nervous system, there's probably interference in your nervous system. How? Because when I take a consultation with a patient, they have traumas that happen, whether it's occupational, lifting on the job for 15, 20 years, driving a car, commuting 2 hours every day, taking care of 5 kids for years and years and years, lifting patients, being bent over as a dental hygienist. I mean, you name the occupation, working on a computer. I bend over all day long taking care of patients, so I'm going to my chiropractor, not because I hurt, not because I don't hurt, because I want my body to be at its best. So chiropractic is for everybody. From the womb to the tomb, as I like to say, we start you out in life to make sure you're expressing your full self-potential. And I want to make sure when you make your transition at the end of your life, that your body is connected completely and fully, so that when you move over, you're moving over gracefully. So you've been riding in the car with the Chiro. This is Dr. Anita from Mylon Family Chiropractic Center right here in Bayville. If I'm not your chiropractor, I need to be your chiropractor, because you need to go to the best. So see you on the next ride.